I think the most rewarding part about being a nurse is the fact that you get that sense of accomplishment day in and day out. You don't have to question if you made a difference. Every day you leave your job, you know you made a difference in someone's life, and I think that's quite rewarding.
My job is one of the most challenging and interesting things that I could ever possibly imagine doing. That it satisfies me on so many levels, mentally, physically, emotionally, and that every day, no matter what happens, I leave with a sense of accomplishment.
Being a nurse to me is just rewarding because it's the fact that the people that you meet so many different people in this field. I mean, going from patients to staff. I mean, you're meeting I met some great people just working here actually. I mean, I know a lot of people in this hospital and they're all awesome. And the patients that I meet, they're interesting to say the least, and it's never a dull moment, so that's probably what I would say the best thing about, or the thing that I find the most rewarding. It's not a boring job.
Every day coming in and being able to help somebody make a difference in their life, either make them have no fear, no pain, get motivated, get out into rehab to get better. So I love every single day helping people. It's my life.
I love nursing. My goal each day is to make a difference in someone's life that day, whether it be a patient, whether it be a staff member. That's my goal for each day. And by working as a nurse, I can provide that to our patients.
In my first career, I really didn't feel like I was making much of a difference, and in nursing I do. I am fulfilled. I'm able to care for people at all stages of their life. Here at Ideal, at the end of their life, it's wonderful.
I find most rewarding as being a nurse just touching people's lives, whether it's a patient or a family member. We're not only here to save lives, we sometimes help the dying patient and family as well too. So I think a lot of it is how we've touched their lives and the impact that we leave on them.
If I was to describe to somebody about being a nurse, to help them to understand what we do every day, was giving our all, giving our lives, giving our education, but also our love and compassion. There's a lot of different moments where you either have faith or you have just a moment of silence to give a hug. A lot of jobs are all mechanical, as you would say, where you're just working on the computer, but for us it's every day. We work with people and their families and their children, and just caring, loving, sharing.
I feel that it's our obligation as humans on the planet. We share the planet with each other, so it's our obligation to take care of each other. We're all interconnected and everyone has their own gifts. And so if my gift is that I can help take care of people when they're sick, then that's what I'd like to do. I also want to instill those values in my son. He's 8, and I would like to see him want to care for other people, whatever job he chooses, whatever path he chooses. So hopefully that example will pass on to him.
So most people's idea of what nurses do are from television. It's very exciting, there's a lot of emergencies, it's very technical, but there's also that human side of nursing. Taking the time just to sit with someone, hold their hand, comfort them, talk to them about anything other than their current place in life or their current illness or maybe an impending death. It's the quiet moments. That is what I think people don't think of when they think of nurses.
Don't get me wrong, there are days when I leave and it's like, oh gosh, what a day, but that's few and far in between. I have more days where I go home feeling good that, you know what, this person, I can see them getting better. And that's probably the key. If you see someone that's actually getting better, then it's going to be more satisfying.
Nursing gives you the opportunity to make a lot of connections with your patients on a whole variety of levels. There's always the patients that you connect with a little bit closer than some of the other ones. Some are strictly a nurse-patient relationship, and others you kind of develop a much deeper connection with through listening to them and just developing that bond of knowing what to provide for them.
I look forward to every single time I'm scheduled to work to see what I'm going to get into to be able to help.
There's one story in particular. A few years ago, I had a patient who died shortly after surgery, and I had taken care of him in the morning before he went to surgery. He woke up at 4 in the morning and was very anxious, and we spent quite a long time talking. He told me a lot about his wife, his children, his grandchildren, that he had newborn twins, grandchildren, and also that he liked to give his grandkids rides on his tractor. We spent quite a long time talking. So when he passed away, I sent a card to his family and wrote down every possible thing I could remember from what he told me that morning. And it really helped them so much with the closure because they never got to say goodbye. And so I felt so glad to be part of that and to help them in their struggle. They at least had some peace in that.
One of the key things for me is after a patient passes, we often attend the calling hours, and the family is so appreciative. And you may not have felt it along the way, but they relay their comfort with you and their thanks for giving their loved one good care.
You know, the prospect of coming to rehab after being hospitalized is not one that most people are excited about. They want to go back home. But they were here, and I learned right along with them as they learned and progressed and got stronger to be able to go home. I was learning my new role, and we were able to take that journey together. And it was very, very sad when they went home, but it was bittersweet, and she'll always remain in my mind.
Obviously, when they leave UHS, I want them to know that the care we gave was the best we could possibly give. I want them to remember the favorable things. So easy to remember the negative parts of things, and hopefully all the good that we provided will outweigh any negative that may have happened.
When a patient leaves UHS, I try to help them, and I want them to remember that we love them, we care, we want them to know that we're here for them no matter what. If they need to come back, that we're here for them, we remember them. That's one thing with a small community. We remember our patients, we remember all the things that they like or they need to make it a better stay and to get them out as fast as we can to get them home. But I just want them to remember our love and compassion and how much we really do care for every patient and family member.
And maybe they took away, maybe they learned something they didn't know before they left on how to care for themselves and stay out of the emergency room. So that's always a nice thing.
UHS helps a lot. For me as a nurse, I have a lot of support. I feel that they care about us, that for us to be able to give the best care. Every experience I have had is positive between my patients or the administration. If there was an issue, they always have our back to be able to do a better job for our patients. Just the support is wonderful.
That's one thing I noticed about UHS, that they stress. I mean, you care for the patients. That's what we're here for. That's one of the reasons I came to work here. I mean, it was just, it matched my own values as far as one dealing with people. If it didn't, I wouldn't be here.
There have been times in my life where I've been in need, or my family has been, whether it's been health issues or other issues, and there has always been someone who has come out of the blue to help us, somebody that I wouldn't have even expected, and I really have appreciated that and haven't been always in a position to give that back to that person. So being a nurse helps me to do that in other ways to people that, you know, may not be able to give back to me or never could give back to me, but it's not about that. It's about paying it forward and, you know, trying to share with everyone.
Nurses Week is about celebrating nurses and all the roles they play, both here at UHS and across the world. So UHS nurses, thank you for all you do.
Thank you, UHS nurses, for all your hard work, dedication to our team, and to all our patients.
UHS nurses, thank you so much for your everyday compassion, for going out of your way, from being away from your families, and going the extra mile to help all of our patients and the people in our community. Thank you very much.